All right, listeners, you certainly know that it is a beautiful morning every time you get the opportunity to come join us here at the Reno Town Mall for Health Matters, starring Dr. James Forsyth of the Century Wellness Clinic. Week after week, we talk about issues that concern you, your friends, family, and associates when it comes to their health here on Health Matters. And we also like to highlight books that have been written by Dr. James Forsyth, who actually speaks around the world on different topics, a well-known oncologist. The book we're kind of highlighting today is The Compassionate Oncologist, and we're going to get into that book a little bit later on, but today's topic, Cancer Patients' Bill of Rights. I'm going to kick it off, Doctor, before we go to questions from the audience and or callers. And remember, join us, Reno Town Mall, get behind a microphone, get on Facebook right now, and either the beautiful Debbie McCarthy or the beautiful Kelly Rush will field your questions or comments on Health Matters. Go to americamatters.us and click on Facebook and call us locally, 775-827-8900, toll free for any of your health questions. It's 855-790-8255. Doctor, you know, when it comes to cancer and the fact that this show is dedicated to Cancer Patients' Bill of Rights, why is positive attitude so important, in your opinion, to cancer patients?
Well, Eddie, I think we all need to realize, and this is from the literature and from my 40 years' experience in practicing medical oncology and integrative oncology, that at one time or another in the literature or in my personal experience, every single cancer, no matter how serious, has been cured at one time or another. And I made a list of about 10 patients of mine who were thought to be terminal and were given basically the word that they should go on hospice, and yet they're alive and well today and free of disease. So I want patients to take away the message that there is hope in cancer. I've heard other doctors tell patients, all he can offer you is hope, and I've told those patients, there is nothing more than hope.
Right.
I mean, hope is everything.
It's the best medicine.
Yeah.
You know,
and a positive attitude goes with that, Eddie, as you know. If they have a positive attitude, they're going to do well. Sometimes that attitude may even be denial. They may deny they're sick. Sometimes a denial attitude is healthy in cancer. But you have to also do the right things, obviously.
You know, Doctor, and personal endorsement, again, we want to thank you for what you did to a family member to prolong his life here, my father-in-law. But, you know, I'll never forget, you recommended that we personally get a second opinion. Why do you always recommend a second opinion, especially one when it comes to alternative medicine, Doctor?
And we'll go into that, Eddie. I wanted to first of all just give the examples of quickly.
Sure.
I'm not going to give a complete medical history, and I'm only going to use initials. I'm not going to, because of privacy rules, we don't give names out here, of course. First patient is a 48-year-old gentleman who lives over the hill in the Chico area, WD, who saw me 10 years ago with a large abdominal mass, and he had been biopsied at home in Chico, and it was found to be a stage 4 non-Hodgkin's lymphoma.
Wow.
Now, lymphoma is a cancer of the lymph tissue, and it can affect the liver, the spleen, it can affect your lymph nodes, it can cause masses in the abdomen and chest. His course was also complicated by the fact that he had chronic hepatitis C, and he'd been on the list for a liver transplant. This gentleman underwent integrative therapy with me for about a 6-month period, and then had follow-up counseling with nutrition and dietary substances, as well as the appropriate treatments for his liver viral infection.
Right.
He is alive and well today. In fact, runs a marijuana farm, if you can believe it or not. In the Chico area, he has a medical marijuana farm, which is perfectly legal, and services other patients with cancer. So that's a case of a patient who was given a wrong prognosis, that he was going to die soon. And if he hadn't had hope, if he hadn't sought alternative medicine, I don't think he would be alive today. The next patient is a very interesting one, and I cover her in my book, Compassionate Oncology. This is E.S., a ranch lady who was in her early 70s from the Alturas area. large cattle ranch woman who had a very highly malignant melanoma. That's a black mole tumor that had invaded her liver. I treated her for several years with low-dose chemotherapy. And this is an amazing case because this lady had a brown recluse spider bite that actually caused a cellulitis and a severe infection in her leg. She had put on her boot one day and there was a nest of spiders in there. She hadn't worn these boots for months. And so the spiders crawled in there and made themselves at home. And then when her foot came down, it was bitten and the leg swelled up. And as you know, brown recluse spider is one of the most horrible types of insect bites you can get.